Are you interested in becoming a psychologist and dream of changing lives and making a big impact? Then you should definitely look into the field of rehabilitation psychology. Now, in an earlier video, we took a quick peek at some of the patient-focused fields you can explore as a clinical psychologist. But today, we're going to dive right into one of those exciting specialties, specifically rehabilitation psychology. Now, it's a great specialty of clinical psychology that covers everything from working with patients up close and personal to digging into research. But for this video, let's just chat about how rehab psychology fits into health services and patient care, and we'll save all the other stuff that rehabilitation psychologists do in another video. If you're into the idea of working side by side with folks who have disabilities and chronic health conditions, then watch the whole video. Rehab psychology might be the perfect match for what you're looking for. So let's just jump in and find right out. So you're probably wondering, what's this rehab psychology thing? Well, let's break it down. Rehab psychology is all about using our knowledge of the human mind to help out folks with disabilities and chronic health conditions live their best lives. We're talking about maximizing health, freedom, abilities, and just taking part in life to the fullest, regardless of how old you are. Rehab psychologists, like yours truly, are all about helping people facing disabilities tackle challenges in every corner of their life. This could be their mental well-being, family dynamics, social life, or even finding and keeping a job. We're there to help them deal with how their disability is impacting their thoughts, feelings, actions, and their life in general. Now, rehab psychology covers a lot of ground. We work with patients and their families in the hospital, and even those out in the community. It's all about helping people recover and rebuild, whether they're dealing with broken bones or dealing with brain troubles. Now, as a rehabilitation psychologist, you might meet people who've had a spinal cord injury or a traumatic brain injury, and in these cases, you're part of a bigger medical team helping people manage everything from their pain, tingling in their arms, bathroom troubles, right down to emotional struggles they might be dealing related to their disability. Other patients might have complicated health conditions affecting their tissues or even their nervous system. We're talking about disorders like Ehlers-Danlos or even multiple sclerosis. We're there for them, helping them deal with whatever their condition throws at them. So you're probably wondering, what does a rehab psychologist actually do? Well, it boils down to probably three main things: assessments, consultations, and interventions. It sounds fancy, but don't worry, I'm going to break it all down right now. All right, so a big part of our job are assessments. We meet with people with all sorts of medical conditions, which means we get to look at a lot of different aspects of their psychological state. This could be their IQ, how they think, their behaviors, their mood, or how they're getting along with others. We're also clued in on other health stuff like sleep, pain, substance use, or even patient sex lives. And because patients in rehab often have both physical and psychological disabilities like trouble moving around or vision challenges, we've got to adapt our assessments to suit their needs. We're pretty mindful of how this might change the test results, so it's all sort of a balancing act. All right, next up we got consultation. That's just a fancy term for giving advice on psychological stuff to individuals, teams, and organizations. We're more like guides. Folks asking for advice actually get the final say based on what we share with them. So when it comes to consultation in a rehab setting, this means other medical providers might ask us for help understanding a patient's behavior. They could need help with anything from getting a patient to stick with a treatment plan, figuring out what's going on with their motivation, handling behavior issues, or even exploring job options for them. And we don't stop there. We also help guide the treatment team, giving them insight into a patient's learning style, what motivates them, their cognitive abilities, and how they're handling things emotionally. This helps the team come up with different treatment goals that really hit the mark. And sometimes we're asked to help develop psychological interventions for different hospital departments and provide advice to folks outside the hospital, like families, lawyers, courts, schools, and even government agencies. Finally, there's intervention. This is where we get to help patients and their families deal with the impact of the patient's disability. Now, what sets us apart is we offer treatment options for patients at any stage of their physical illness or injury. All right, so the type of help that we give can really change based on where the patient is and their specific needs and how long they've been dealing with their disability. And we often work as part of a team alongside nurses, physical therapists, occupational therapists, speech, language pathologists, and even recreational therapists. For folks with cognitive challenges like brain injuries or strokes, we often use techniques from cognitive rehabilitation. This is all about helping people get better at doing everyday tasks, whether it's about restoring lost skills or coming up with workarounds. We've got you covered. Ever wonder what a typical day looks like for a rehab psychologist? Well, it's a mix of assessments, consultations, and interventions, but it really depends on where we work. So let's break it down, comparing outpatient versus inpatient settings. So say I'm working in an outpatient chronic pain rehab service. My day might kick off with a thorough evaluation of a patient dealing with persistent low back pain or a condition like CRPS. Then I might spend a couple of sessions helping patients overcome functional problems one-on-one or in group rehab to help them deal with emotional issues or physical functioning issues through personal or group therapy. I'd also spend an hour maybe supervising a trainee psychologist. And of course, there's paperwork, right? So writing reports, documenting treatment, handling billing. Paperwork isn't the most exciting thing, but it's got to be done. It's part of the job. All right, so on top of all this, I'd probably have a chat or two with other therapists like speech language pathologists, occupational therapists, or physical therapists to talk about how patients are doing and help plan treatment in conjunction with them. Now, if I'm working in the inpatient rehab unit, my day looks very different. I might start off with a team meeting to discuss how our patients are doing and any hurdles that might be slowing down the patient's progress. I might even tag along with the doctors, nurses, and residents on their rounds, just checking in on the patients and identifying any issues we need to sort out. I'd also spend time running individual or group or family sessions to help folks cope with their rehab journey. All right, so throughout the day, I might mentor some students and consult with other professionals. It's busy. It's a dynamic job, but incredibly rewarding to help out people overcome their challenges and just live their best lives. All right, so thinking about becoming a rehab psychologist, let me just walk you through a couple of steps on how you can actually get there. First off, you got to get a doctoral degree in a health-related psychology program like clinical or counseling psychology. Along the way, you'll do a 1-year internship with a rehab focus. You might do it in a big medical center or an outpatient clinic or maybe a veterans hospital. All right, so once you completed your internship and you got your doctoral degree under your belt, you'll then need to head off to a rehabilitation psychology fellowship for about 1 to 2 years, where you're going to become specialized in the field of rehabilitation psychology. Now, during these internship and fellowship years, you'll get a taste of all sorts of inpatient and outpatient experiences. And then after you're done, you might choose to focus on a specific area like brain injury or limb loss, or you might choose to dip your toes in a bunch of different fields, working with different populations and in different settings. It all depends on what you learn from your time in internship and fellowship. Now, this internship and fellowship time is super important, and not just for experience, but because it helps you clock enough hours to actually qualify for a psychology license that you'll have to get afterwards. And if you want to go the extra mile, you might even decide to get board certified in rehab psychology. This means that you're just going to go through American Board of Professional Psychology and take a pretty hefty exam to prove your skills in several domains in the field. Now, it's pretty hefty. It's not a walk in the park, but it is one way to help stand out from other rehabilitation psychologists in the field. So now you might be wondering, what's so great about rehab psychology as compared to other things? Well, there's a lot to love, actually. One of the big things is teamwork and how teamwork focused it is. Probably more so than any other field in clinical psychology. Rehab psychology is incredibly interdisciplinary, and you're going to work alongside a bunch of different people like physical therapists and occupational therapists and speech therapists. Especially if you're in an inpatient setting, you'll get to work with a lot of different people all day, every day. But is rehab psychology the right fit for you? It's a great question. If you're somebody who's great with people, you might find that this field is a good match for you. People who thrive in this field are typically team players who enjoy working with others in a collaborative, team-based approach when it comes to patient care. And if you're somebody who's naturally upbeat and optimistic, you likely do well in this field. We see patients who have functional impairments that might last for a few months or even their whole life. So if you're somebody who has a positive outlook, that can really make a difference to the field, especially for your patients. All right, so just to sum it up, if you're a team player and you've got a positive attitude, you might find that rehabilitation psychology is the home for you. But wait, there's more to the story. You might be thinking we're wrapping up our chat on rehab psychology, and we are, but we're just getting started. You see, there's a whole other area we got to dive into, which is clinical psychology. So right here in my other video, we've got some great bonus tips for you. Want to learn the secrets of becoming a health service clinical psychologist? If so, why don't you hop on over there to the other video? It's just one click away, and I promise you it's going to be time well spent. And if you thought this was the end of our journey, it's really only the start. I have some other videos that take deeper dives into the world of clinical psychology and talk about other specialties like clinical psychology, neuropsychology, and pediatric psychology. And here's the deal. If you don't watch these other videos, everything we've covered in this one probably won't fully sink in. So if you've made it this far, let's just keep going. Go ahead and click over there, and I'll see you in the next video.